Welcome to this presentation, one of a series of 3 on the New South Wales Work Health and Safety Act. This presentation is aimed at managers and supervisors, as you have a key frontline role implementing the policies that help shape the safety culture in your organisation. The other 2 presentations in the series are for workers and executives. A guidebook entitled WHS Essentials for Nurses and Midwives supports all presentations and provides more detail, including many examples relevant to the health, aged care or community sectors. The Association acknowledges the support of WorkCover New South Wales in providing funding for these resources and trusts you find them useful to supporting initiatives to achieve a safe workplace.
In 2008, the federal government committed to providing consistent health and safety legislation across Australia. This resulted in model legislation which was adopted in New South Wales as the Work Health and Safety Act, in force from January 2012. The WHS Act provides the framework for protecting the health, safety and welfare of workers and others at the workplace. It outlines who has a duty under the Act and their responsibilities. It defines specific obligations such as risk management, consultation and worker education, and it provides for compliance and enforcement. The WHS regulation provides the detail on how the duties prescribed under the WHS Act must be performed. Practical advice on specific aspects of the legislation can be found in the Codes of Practice and Guidelines, many of which are relevant to the work of nurses and midwives. The legislation identifies 3 main duty holders: the PCBU, officers and workers. PCBU replaces the term employer. PCBU stands for the person conducting the business or undertaking. The PCBU can be an organisation such as a hospital, aged care organisation, nursing agency or university. Or it can be an individual, such as a partner in a medical practice or someone who engages a nurse or midwife privately. A PCBU can also be a nurse or midwife who operates as a sole trader. The PCBU is the principal duty holder and must ensure, as far as is reasonably practicable, that the workplace does not expose workers and others to health and safety risks.
So it's an exciting time for us. We've got the opportunity to design a new purpose-built maternity service, and that includes a labour and birth room that's a lot different to our current high-tech environment. So we've been working with the occupational health and safety consultants, and they've been coming on site with us as well as the architects to actually, walk through what our environment will look like, and that's about space between the edge of the bath and where the clinician would sit. That's access for the women who might need to use a wheelchair, and it also looks at the needs of bariatric women, which is increasing needs of our clientele.
This duty is not limited to employees. It applies to any worker whose work is influenced or directed by the PCBU, such as agency personnel and contractors. It also applies to others at the workplace, such as patients and visitors. The duties required are comprehensive and include ensuring the safety of the work environment, ensuring that the systems of work are safe, providing information, training and supervision, establishing and maintaining effective worker participation in WHS, including consultation and issue resolution procedures, providing facilities for workers' welfare, monitoring workplace conditions, and the health of workers exposed to specific occupational risks such as radiation, notifying WorkCover New South Wales of certain incidents, and establishing effective dialogue on WHS issues with other PCBUs that work at the workplace. Reasonably practicable is the standard for the PCBU to comply with its obligations under this legislation. It means that the PCBU must take all reasonable steps to manage WHS issues. It's a balance between what is known about the risk and the ways to eliminate or control this risk, the time and effort involved, and after all other considerations, whether the cost is disproportionate to the risk.
We use SlideSeat as a manual handling aid. staff, there was a problem that staff were not using it. And when we asked them why they're not using it, and they said that it's hard to find in the residence room and it's hard to reach when they're trying to use the slide seat. And we bought a few containers, and what we did, we put the containers behind the bed, so that way staff can reach easily whenever they need to use it. So now they are using it, and we don't have that problem anymore.
As an organisation, a PCBU makes decisions and acts through individuals known as officers. An officer is a person who makes, or participates in making, decisions that affect how the organisation operates. Factors that determine whether a person is an officer include how much influence they have on the decisions affecting the whole or a substantial part of the organisation. For example, approving major project funding.
It's important as leaders that we take the responsibility of doing what we can to drive a continuous improvement process. We can make a healthy and safe workplace if we put our minds to it. If we share in the communication role and responsibility, we can drive that process through good leadership.
Officer is a legal term. A person may have a job title that includes the term officer, executive, or even director. However, they're not necessarily an officer unless their responsibilities and level of authority conform to the definition in the legislation. The legislation prescribes duties or responsibilities based on your role. So if you're not an individual PCBU or officer, then you must be a worker, albeit with managerial or supervisory responsibilities. Some nurses and midwives take on director roles on professional boards and foundations associated with their work. If the organisation is a PCBU, then you would be an officer for this role, even if the role is voluntary.
Safety is important for everybody, not just for me. Like, I could easily leave that and just go see you later, but it's not going to make it any easier for me and my shift and my patients if that nurse hurt themselves because I didn't fix it or I didn't notify it to anybody else.
The WHS legislation does not define a specific role for managers and supervisors. You're defined as a worker. Workers can include employees, agency nurses and midwives, contractors such as visiting medical officers, physiotherapists, plumbers, security personnel and service technicians, volunteers, university, TAFE or school students on placement, apprentices, sales representatives providing training at your workplace, ambulance officers, funeral transfer personnel and delivery personnel. All workers are required to take reasonable care of your own health and safety. Take care not to put others at risk by anything you do or don't do. Comply with reasonable instruction, and once advised, cooperate with WHS policies and procedures.
So safety is important to me as a manager at work, is that I provide a safe environment and that they can come to me as a manager and tell me about any issues they've had with safety or any areas that I need to improve.
As a manager or supervisor, you're expected to lead, guide and support all workers who report to you in the safe performance of work. So you have a key role in developing, implementing and monitoring how WHS is managed within your area of responsibility, allocating staff to match the demands of the work and skill set of workers, selecting and allocating equipment, supporting and promoting WHS training, acting on reports of hazards or incidents, dealing promptly and fairly with workers who exhibit unsafe behaviours, ensuring WHS is considered in all planning and facilitating consultation and worker participation in WHS. Later in this presentation, there is some specific information on some of these issues relevant to your role.
Part of my role is keeping me up to date with occupational health and safety information, and I do this by attending conferences. I read LAMPs and also aged care journals.
The standard required of a supervisor or manager is the same as for a worker. That is, you're required to take reasonable care. This is always balanced against the PCBU's actions to do what is reasonably practicable, according to the systems of work in place at the time, the training, instruction and supervision you received as a supervisor, whether you were working within your stated role, whether any other person was placed at risk, and whether you acted intentionally or recklessly. As a manager or supervisor, you may also be asked to do tasks that fall within the responsibility of an officer. Delegation of tasks does not mean that the duty is transferred to you. Officers remain responsible for any duty required by legislation.
It's their job. I'm doing my job by telling them they have to do their job and fix it so that the rest of us don't get hurt.
Patients and visitors also have responsibilities not to place anyone at risk. It is unacceptable for anyone to refuse to cooperate with safe work procedures, make unreasonable demands, bully or threaten workers. Patients and visitors are also accountable for any criminal behaviours, such as assaulting or threatening workers and interfering with safety equipment. Information on these responsibilities and what can be expected for non-compliance need to be communicated to patients and visitors. For all duty holders, there are penalties for non-compliance with the legislation. The penalty for a manager-supervisor is the same as for a worker and can be up to $50,000 for the lowest category offence. For higher category offences, such as reckless conduct, penalties can be up to $300,000 and can also include a prison sentence. A key responsibility of managers and supervisors is the implementation of workplace policies that address WHS. WHS Essentials for Nurses and Midwives provides detail on these responsibilities, and we encourage you to take the time to read this guide. For this presentation, we focus on just 4 responsibilities, each requiring you to take action to ensure compliance. These are consultation, risk management, issue resolution, and notifications to work cover. Most organisations have well-established health and safety committees. These committees remain an important mechanism for dealing with organisation-wide issues, such as assisting in the development of WHS policies and monitoring the effectiveness of strategies to address WHS issues. For dealing with local WHS issues, health and safety representatives, or HSRs, are recommended. An HSR is elected to represent workers in a work group, which is a group of workers who perform similar functions or work in defined areas. HSRs have a number of functions, but essentially they represent workers and negotiate with local management on WHS issues. Depending on your role, this could mean the HSR negotiates with you.
As a health and safety representative, it means that I'm quite important on the ward because I have to attend those meetings. I need to inform the committee if there's any issues that can't be addressed on the ward, and vice versa. I need to let my colleagues on the ward know if there's any important issues coming out of that meeting.
HSRs and their deputies are elected for 3-year terms. HSRs have certain powers, which include directing unsafe work to cease, issuing notices to correct anything that is unsafe, and requesting assistance. Assistance may come from WHS professionals, work cover, or the WHS professional officers from the association. While the training is not mandatory, the association recommends all HSRs undergo the training to fully understand and carry out their role. You might like to consider doing the HSR training too. It provides great grounding in WHS. The association believes the best WHS outcomes will be achieved with both HSCs and HSRs. Other arrangements are possible, so all workers need to be involved in determining the best approach for their workplace.
It's good business for us to be involved in work health safety, and as leaders we have to lead that process. and engage our employees the best way we can.
As a manager or supervisor, you have a key role in facilitating consultation, which includes engaging with workers about consultation and participation, including determining work groups, supporting, mentoring and encouraging worker participation in WHS, engaging with workers about their work and any WHS concerns, facilitating training for HSRs and HSC members, and supporting HSRs and HSC members in their role, including rostering to enable them to undertake the functions associated with their role. Risk management is critical for ensuring that a workplace remains safe. It involves identifying hazards, assessing the risks, eliminating the hazards and therefore the risk, or if this is not reasonably practicable, controlling or minimising the risk, and reviewing the controls to ensure they remain effective.
So internally we work with our education team and we look at our incident data to see where staff are having issues with work. So there might be a cohort of people having wrist injuries from holding on CTGs in labour rooms.
Risk management is used to determine the risk of a particular situation and then develop formal and documented strategies to eliminate or control that risk. It's a structured process involving standards and assessment tools, including those for specific hazards like manual handling. In situations requiring risk assessment, such as evaluating a new system of work, new item of equipment or upcoming building project, it will be your responsibility as the manager or supervisor to put together the team to undertake the assessment. This team should involve workers from the relevant workplace and at least one person trained in risk assessment to ensure the team undertakes the risk assessment according to the legislation. You may also need to seek expertise from outside the organisation, such as an ergonomist or other safety professional. Remember, it is the responsibility of the PCBU to lead the risk management process. Importantly, all workers need to be informed about the hazards and the potential risks they're likely to encounter in their workplace. They also need training in how those risks are to be managed according to the hierarchy of control. While workers should always be empowered to deal with risks, they also need to recognise when a risk is beyond their expertise or training. And in reporting the risk to you, all workers should be confident that you will deal with it effectively and efficiently.
We need to contact Work Health and Safety immediately. I will go and do that. Could you please let all the colleagues know not to enter this room and isolate the area?
Okay. You also need to be aware that workers have the right to cease or refuse to carry out work which they believe is unsafe and exposes them to an immediate or imminent hazard, such as working with faulty equipment. As the supervisor or manager, you need to deal with the immediate risk. If the worker's not injured, you will need to reassign them work away from the hazard. For various reasons, some WHS issues remain unresolved and continue to be a problem. The legislation now mandates that there must be reasonable efforts to resolve any WHS issue. Your workplace must have a documented procedure for resolving WHS issues, and if not, the legislation provides a default procedure. All workers need to be aware of this procedure. As part of the process for resolving the issue, the PCBU must be represented by someone with sufficient authority to negotiate on its behalf. Likewise, workers must be represented, either by the HSR or a nominated representative such as the association. For issues that remain unresolved, WorkCover will assign an inspector to assist in bringing the matter to resolution.
The other area they can report safety issues to me is through our INS program, so that's the computer based. So if I'm not here and they won't see me, they normally leave me a note or a phone call, but there is the mandatory reporting system through our computer system.
The legislation requires that serious workplace injuries or illness and dangerous incidents must be reported to WorkCover New South Wales immediately, as soon as any supervisor or manager is aware. There should be procedures at your workplace to advise you how to go about this. Following notification, WorkCover may issue a non-disturbance notice so that the equipment or environment remains as it was until they've investigated. Importantly, for some incidents, you may be required to report to multiple agencies. For example, if a sling on a hoist fails and a patient falls, irrespective of whether there is an injury, the incident may need to be reported to the Department of Health, the Therapeutic Goods Administration and WorkCover New South Wales. The association is both a professional and an industrial organisation. A key part of its role involves assisting individual members and organisations on WHS issues. The association also provides support and advocacy to members who raise WHS issues, including negotiating on behalf of workers to resolve WHS issues. The association's WHS professional officers, as well as some organisers, hold WHS entry permits. This enables them to investigate WHS issues on site at any workplace where nurses or midwives work.
Work health safety is the law. You know, like, I want to take care of my staff, I want to take care of my patients, I got to take care of myself. So it's kind of like a community thing, I guess.
So safety is important to me as a manager at work, is that I provide a safe environment and that they can come to me as a manager and tell me about any issues they've had with safety or any areas that I need to improve.
We want our staff to be safe and feel safe, and we want to retain our staff.
With the design of our new facility, we've had the opportunity to work with all our staff, as they've all played a really important part. They've had the opportunity to look not only at their own personal space and what their requirements are, but also how they all link in with each other.
The new work health and safety legislation has enormous potential to improve safety outcomes for all of us.
The Association hopes you've found this presentation a useful introduction to your role under the Work Health and Safety Act. More detail is provided in WHS Essentials for Nurses and Midwives, along with best practice examples for nurses and midwives across a range of working environments. The guide also includes a comprehensive list of WHS resources for you to explore. You can also contact the Association for more information or assistance.